Last week, Dr. Ajoke Adewole, a public health physician and epidemiologist, shared our thoughts on home-based care of COVID-19 cases. This week, we bring you the concluding part. First, we begin the show with COVID-19 updates. I'm Olasunbo Modupe. Welcome to the show.
Heads of states, global health leaders, scientists, and the private sector have come together at the Paris Peace Forum to discuss how to meet the urgent funding needs of the ACT accelerator. According to the World Health Organization, new contributions bring the total committed to over $5.1 billion, but an additional $4.2 billion is needed urgently this year, with a further $23.9 billion required in 2021 if tools are to be deployed across the world as they become available. The Access to COVID-19 Tools ACT Accelerator is the proven up and running global collaboration to accelerate the development, production, and equitable access to COVID-19 tests, treatment, and vaccines. It was set up in response to a call from G20 leaders in March and launched by the WHO, European Commission, France, and the Bill and Melinda Gates Foundation in April 2020. As part of efforts to ensure safe reopening of NYC camps, prospective core members must fill the COVID-19 test self-reporting form online, print call-up letter, slip, and code, adhere to assigned reporting date at camp, have at least 4 washable face masks as well, and also comply with all precautionary measures. The Nigeria Center for Disease Control says it is working with the National Youth Service Corps to conduct COVID-19 tests for all corps members and provide guardians to prioritize their safety. The NCDC has also completed sample collection for the ongoing zero prevalence survey in 4 states, while 2 states are to be added before the year ends. This, it says, will help estimate how widespread the transmission of COVID-19 was in Nigeria over the past 10 months. More than 65,000 confirmed cases and over 1,100 deaths have been reported in Nigeria. Worldwide, there have been above 54 million confirmed cases of COVID-19, including over 1.3 million deaths reported to the World Health Organization.
The Nigerian Center for Disease Control says in order to reduce pressure on the health system, cases which are asymptomatic or have mild symptoms may remain in isolation at home with access to clinicians to monitor health condition and have access to quick evacuation to a treatment center should they need urgent medical intervention. This assessment will be based on the infrastructure of the state and health-seeking behavior of its citizens. Dr. Ajoke Adewole, a public health physician and epidemiologist, will share her expertise with us on home-based care of COVID-19 cases. Okay, the Lagos State government has toed the line with home-based care through a co-telemed. What is the procedure? I know there has to be an assigned caregiver. Looking at the numbers of frontliners, can the country's healthcare system afford that now? Do we have enough resources for this arrangement?
Honestly, the we are Nigeria, and that is why interventions that are going on in several parts of the world may not apply to us. We know the bulk of our resources. We know the bulk of our manpower. There are a lot, in recent times, the government has trained some community health workers, and they are still doing so. To be a caregiver is not that you have to go to school and be a doctor for 6 years. These are people that are easily trained to do one or two things. And the clinician also is going to be in touch on food. So the bulk of our manpower are still rudimentary. There was a time I know that even before COVID-19, they trained TBAs, traditional birth attendants, because we realized that in our own setting, people will still go to traditional birth attendants. So we have been the one clamoring for a tailor-made intervention, an intervention that will be useful in African setting. And here is it. We are not saying that this will be perfect. We've not seen the end of this. But it is a method worth trying out. So we should definitely, before it has even been tried out, the risk management, the risk has been assessed before. There's been a risk assessment to see what can be done. And in case there's an explosion or there's an issue that, comes out of this home management testing, home management guidelines, this mitigation of these incidences have already been put into place. For instance, let's say that, a whole street develops COVID-19, which is not likely to happen with all the measures that have been put in. There are guidelines to ensure that things are still being brought under checks and balances. Okay. So we have to try, because our data has shown and our resources and assessments has shown that it is worth trying. And it's something I'm told, but definitely it's something that we'll also learn as we do and see if it is worth pursuing in the long term or not.
Okay, can the care received at home be compared to the one received at the isolation center? And now we would like to hear from you. How do you help patients manage stress and fear during the pandemic? Because it's not just about checking the temperature, ensure the person eats, ensure the person gets along. How do you manage fear and anxiety now?
Yes, that is important. You asked the question first, but I'll answer the latter first. Answer the latter question. Doctors are trained. Even when it was not COVID-19, not just doctors, health workers in general, when it wasn't COVID-19, every patient that has an illness, especially a serious illness, will come with some form of stress and anxiety. So they definitely need to be reassured, educated about their disease states, so that they can even take better, they can even respond to the illness better and take control, take responsibility, even as they are being managed. It doesn't differ for COVID-19. So the moment I have been involved in contact tracing and management of some patients, and what we did, the moment we call you, we reassure you, we ask of other social problems that may be affecting your response to treatment. So this is something that has already been in the works. As a professional healthcare provider, it is your duty to reassure and make sure that you gauge the stress levels of your client, of your patient, and make sure that these things are put into check. If they need specialists or mental health care experts, you introduce them into the whole mix, into the whole management mix, because sometimes management is multidisciplinary, like you mentioned.
Okay. And the first part of the question I asked about, can you compare? I know you cannot compare the care at home with the one at the isolation center, but how do you reassure the COVID-19 patients about this?
Yes, definitely a patient will feel more assured in an isolation center that in case something goes wrong, help is nearby. And that is the same thing we try to replicate and make sure that not only do we reassure, we make sure that these things are indeed available.
Okay.
So there are ambulance services, there are numbers to call that are reachable, personal numbers and regular numbers to call. There is I am not in the system of this home management as such, but I am aware of the principles and guidelines upon which it was set. And I have also received training. I have reviewed the guidelines on my own. So there's checks and balances to make sure that in case you are not comfortable, sometimes it's not even about the symptoms. It's about the way the client feels he's being managed. He's not happy that, he's being managed at home. And we prioritize, those patients we prioritize for testing. So it's about making sure that indeed the ambulances are available, logistics are set, oxygen is available upon arrival in case of deterioration of respiratory function. So all these things will be made available, and also communication. Communication will not be lost, should not be lost in this process.
At this time, many healthcare workers are being pushed to their limits as they selflessly care for patients. Not only are they under enormous strain, they also face the fear of bringing the disease home to their families. How do you cope with this, and what advice do you have for colleagues out there?
Doctors like myself and other healthcare professionals, we already swore an oath and we knew what we were entering when we decided to undertake this profession. But at the same time, we also urge the government to continue and improve on their efforts. I won't say they are not doing anything. In fact, they are doing a lot. But when you have a lot more in front of you, you just have to increase your efforts. Like you mentioned, a lot of my colleagues are falling prey to COVID-19, and some have even passed on because of COVID-19, because they were carrying on their oaths, their professional activities in caring for people with COVID-19. PPE has to be made available, and as a doctor, if you're working, or as a medical care provider, if you're working in a scenario where in a situation where there is no personal protective equipment, you should let them. You should not work without personal protective equipment. Also, with the personal protective equipment, you should use them well. There are techniques to be used. All the training provided. And right now, every doctor in Nigeria, and indeed in the world, should already know about how to wear PPE and how to protect themselves against COVID-19. Because we are all frontliners. Whether you're seeing patients in the clinic, or you're in the emergency room, or you're operating patients, you're a frontliner, because nobody's going to write, I have COVID-19 on their faces. And most people do not even know they have COVID-19 when they're presenting to you. So, the government should play its role and make sure that there is continuous training and personal protective equipment. Medical care workers should make sure that they utilize these trainings and these equipment adequately. You have a right, if you go back to your laws, I'm not instigating anything, but you have a right to insist on this before you offer services. So I encourage us all. This is a battle we will fight against COVID-19, and we will beat it. We will beat it.
Okay, amen to that. So I would like to ask you, would you term the decline in infection rates to be that we are close to the end of the pandemic? Would you say we are close to the pandemic in Nigeria, unlike what other people have said? Some school of thought believes that because we are recording low infection rates, it means we are actually flattening the curve.
I would love to go with that school of thought because it's an optimistic point of view, and we always want to keep optimism in the air. But at the same time, I would like to say that the same way COVID-19 caught us unawares, without knowing that such a disease ever existed, it's a novel virus, it's the same way it can resurge once we lower our guards.
Okay.
We have to be very, very careful because we know that we're already exhausting our resources in the management of COVID-19. We should not let down our guard. There should still be social distancing. There should be wearing of masks, washing your hands. Even if these things even if it means COVID-19 is reducing in incidence, there are other diseases that we're going to be protecting ourselves by simply following these measures. So my simple advice is to hold that point of view in plain sight while making sure that we intensify our efforts on putting down, reducing the scourge of COVID-19.
Okay, before I let you go, Dr. Adewole, I would like you to re-emphasize how to handle waste management generated during this period, especially now that we are considering home-based care.
During this period, you should not handle waste, especially if you know that it's coming from a house where they are managing COVID-19 patients. You should not handle it with your bare hands. And you should always make sure that, you're with your face masks, you are with your gloved hands. When you're packaging waste from such houses, or likely, in fact, general waste, because right now you may not be sure who, make sure that you repackage the waste, you tie it, and you place it away from places where children or anybody can just run into it. You don't place the waste where somebody can match on it or collide with it. If it's from a home where they are managing COVID-19 patients, you want to make sure that you rebag it, you keep it aside from household waste for at least 72 hours before you now put it along with every other thing that Loma or whoever is coming to take away from your house. Separate the waste COVID-19 patient for at least 3 days.
Okay, Dr. Adewole, we sincerely appreciate your time and expertise on sound health.
Thank you. It's always my pleasure. And before I go, I'd like to say, wash your hands. Wash and wash again. If you can't wash, use a sanitizer that has at least 60 to 70% alcohol. Thank you.
We sincerely appreciate your time and expertise, Dr. Adewole, on the show. We have been talking to Dr. Ajoke Adewole, a public health physician and epidemiologist on home-based care of COVID-19 cases via Skype. Sound Health continues in a moment. This is where we say thank you on today's episode. Please seek medical help early enough and join hands with the state government to flatten the curve. Do not increase the statistics by adhering to all precautionary measures against COVID-19. For comments and enquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.